a sharp rise in the number of patients asking GPs for appointments. Pent-up demand from the pandemic has been released, leading to what GPs are calling a tsunami of patients. March saw a 20% rise in the number of patients on the previous month. A lot of people who are really quite sick but have been holding off seeing their doctor are now asking to see them. Professor Martin Marshall, chair of the Royal College of GPs and a practising GP in East London, is on the line. Professor Marshall, good morning.
Good morning.
Did you and colleagues always suspect that there would be this pent-up demand?
Yes, we did. General practice has been under increasing pressure for nearly a decade. But as we emerge from the pandemic, this is reaching crisis proportions, I think, for many practices around the country. It isn't just about the increased number of consultations, although, as you say, general practice is delivering a record number of those. It's about how complex the problems are that we're dealing with. It's about increased time spent on administration. It's about looking after patients on waiting lists. It's about contribution to the vaccination programme. So we did expect, as we came out of the pandemic, for things to increase. But what we've got is a very significant crisis on top of a long-term problem.
I was going to say, what sort of conditions are you and your colleagues seeing patients present with?
All kinds of conditions. Some conditions that people have held on to the problem over the pandemic because they haven't wanted to burden the NHS. They haven't wanted to expose themselves to the risk of infection. So that might be people, for example, with hip pain or knee pain that might need to see an orthopaedic surgeon. We're seeing a lot of people who have long-term conditions that have been relatively stable, often where they've been looking after their own condition with support from general practitioners on the telephone or on a video, but they're now wanting to come in and see their GPs. And we're also seeing some patients who are really quite ill, who've been waiting around because they've wanted to protect the NHS and are now coming to see us. So lots of different conditions.
You mentioned the other parts of the system, which have obviously been under unprecedented pressure. To what extent are backlogs elsewhere in the NHS putting additional pressure on GPs who, as it were, are on the front line?
That's an important question because the system should be all integrated. And when you feel pressure in one part of the system, you feel pressure in other parts. And I have to say, we do tend to hear more about hospital waiting lists and wait times in emergency departments than we do hear about pressure in general practice. But when you get pressure in one part of the system, inevitably that transfers to other parts. So waiting lists, hospital waiting lists, for example, general practice are playing an enormous role in supporting those patients who are often waiting for a year or 2 years in order to get a procedure.
But also, presumably, because GPs don't like to whinge, they just want to get on with the job. But the fact is, compared to when you started out, if I may say, 30-odd years ago, you were seeing, 22 patients a day. I mean, the context for this discussion, Professor Marshall, is that nowadays you're seeing up to 50 or 60 in a day, and there are still the same number of hours in a day.
That's exactly right. And if I was a patient, which I am occasionally, I wouldn't want to see my GP at the end of a 12-hour day and be the 50th or 60th patient that they've seen. The kind of pressures that general practices are working under is impacting on, despite their enormous efforts, the quality of care that they're able to provide for their patients, the quality of care that they're trained to provide. And that's causing massive stress. That's causing some GPs, the only way they can cope is to work part-time, and a growing number of GPs of my generation who are retiring early. And that, of course, causes a spiralling problem.
But of course,
increased pressure on other parts of the system.
So, sorry to interrupt. But of course, a lot of people would say, Professor, that the NHS has had a huge amount of financial support during the pandemic. That's eventually going to have to be paid for in terms of borrowing or eventual taxes. What further help would you like? And how much of that is financial help and how much is it practical?
Well, there are a number of things that can and are being done to address this workload crisis. Some of them are relatively small things, trying to reduce bureaucracy, investing in new telephone systems, helping patients to access other services for minor problems like pharmacies. But actually, the main solution here has to be a larger workforce. What we've seen is growing need, growing demand, but not a commensurate increase in the number of GPs or the number of non-doctors working in the primary care teams. In 2019, the government made a manifesto promise to increase the number of GPs by 6,000 by 2024. We're 2 years into that 5-year period, and the number of GPs has barely increased. Maybe 400 full-time equivalents is the maximum. So government really do need to redouble their efforts to increase the size of the workforce, and that does require more investment, no doubt about that.
Professor Martin Marshall from the Royal College of GPs, thank you very much indeed for your time.
3 minutes to 7, time to turn to Nick